Kenya is on a verge of a major healthcare transition from the former National Health and Insurance Fund, also known as NHIF, to the Social Health Authority, or SHA. The Social Health Authority, or SHA, is Kenya's new government health insurance system, replacing the National Health Insurance Fund. SHA is designed to provide affordable universal health care for all Kenyans, ensuring that families can access essential health services without the burden of high medical bills. Through SHA, the government aims to cover healthcare costs for both preventive and curative care, with a special focus on ensuring no one is left behind, especially those in rural areas. Registration for SHA is simple and can be done online via USSD Code or through local government offices. The goal is to transition millions of Kenyans into the system to achieve universal health coverage across the country. With the SHA rollout set for October 1st, the government aims to provide affordable and accessible healthcare for all Kenyans.
The end date for NHIF claims and payments will be on the 30th of September. That means anybody who is admitted on the 30th of September and will be in the hospital for that period will be entitled to the NHIF benefit. And therefore, the claims will be paid based on the NHIF rates. Anybody who goes to hospital, treated, discharged, inpatient or outpatient, effective 1st of October, will be treated under the Social Health Authority benefits. And therefore, when the facility claims for reimbursement from Social Health Authority, they will be claiming based on the Social Health Authority benefit packages.
However, with only 1.2 million households registered so far, concerns are being raised about the low registrations number, especially in rural areas.
Why should a Kenyan register? Yeah, we need to be clear why they should register. They should register so that each one of us can access health. For those who can afford, then they will be in the scheme. For those who you need to register so that if you cannot afford, the government can then budget to pay for you. That's why you need to register. You need to register because when your child goes to school, we want every child covered. We want every child's medical attention to be provided. But you have to register so that your child is captured. You know, by registering, you will register together with your family. And then, so that when your child goes to school, they are in the system for them to be covered by government and by the health services that we are providing.
Leaders like Tharaka Nithi Governor Muthomi Njuki emphasizes the need for innovative strategies to reach over 44 million Kenyans who are not yet in the SHA system.
Let's think of an arrangement where it is possible to have drugs through a funded system to the counties. Do you have banks that are willing to do that? Who will give us a guarantee? Can the national government talk to friendly banks and tell them, as long as money is going to drugs, pay KEMSA for this county, and the exchequer is released, you will be the first charge. If you have an arrangement like that, there will always be drugs in the facility. The doctors and the nurses will always be paid. But as long as we are relying on a system which delays exchequer for 3 months, our medical needs for Kenyans cannot wait for 3 months to be met.
While challenges like possible court cases and funding delay looms, officials are still optimistic.
Our figures now go to daily average is about over 60,000 Kenyans are registering daily. We expect this number to go up as we go towards the deadline of 30th September for effective treatment under the Social Health Authority benefit 1st of October.
The Ministry of Health is working closely with the county government as well as community health promoters to ensure that every Kenyan has access to affordable healthcare services.
The community health promoter is a very critical person in this process because they will assist through the registration, which is very critical, and especially at the bottom of the pyramid. These are individuals, men and women, who have been able to visit already 7.8 million households.
Public health leaders are committed to making SHA a reality, even if adjustments are needed.
Our collaboration with stakeholders, the governors, among others, is really vital and critical for the success of this. So we will continue monitoring the SHA rollout. We will continue improving the system. We will address the funding gaps and enhance digitization efforts to improve healthcare delivery and data management in Kenya.
The Ministry of Health has already done an assessment of all the levels of facilities in this country. The 14,000 health facilities in this country, which includes the public health facilities, the private health facilities, the faith-based health facilities. So we know the gaps, or we knew the gaps even before now. And what we are doing is to ensure that these gaps are fixed in terms of human resources, in terms of infrastructure, and also in terms of equipment that is meant to treat people.
As the shift to Social Health Authority nears, Kenyans are being encouraged to register and embrace a healthcare system that is designed to avoid reliance on community fundraisers and provide secure, sustainable care for all.
It is the first time that we have a social health authority that is designed to take care even of the non-payroll people. People who ordinarily do not have a salary at the end of the month. So if we achieve this, then we will be able to take care of all these WhatsApp group harabes, which are very irritating to all of us. And we participate to them because our financing strategy as of now is WhatsApp. So what we are saying, can we change from the WhatsApp approach and we come to a formal system, which is actually a social health insurance system, but also government supplement by providing the public sector with everything that is required to provide a service so that purchases are made from there.
As we all know, health is a big component of what affects the people of Kenya. We have committed ourselves jointly between the national government and the counties on collaborating on this very important subject that is otherwise devolved to the counties, but that requires our collaboration and working together because matters health are very serious. We all know statistics show that close to 1 million people every year go into bankruptcy because of hospital bills.
Chimtai Kiri reporting for Linda program on CAST TV.